Dear colleagues, experts and friends on migrant health. My name is Marc Sprenger, Director at the European Centre for Disease Prevention and Control, and I would like to, together with my co-hosts, Professor José Miguel and José Carreras, welcome you to this workshop on migrant health and infectious diseases here in this beautiful Lisbon. I would have really loved and enjoyed to be with you in person today, as it is the first time we host a meeting on migrant health that cuts across several disease-specific areas and with participants from all over Europe. So this workshop is really a landmark meeting. Migrant health and infectious diseases is increasingly becoming a topic which is high on the EU agenda. And already in 2007, migration and its implications on health were put on the EU agenda, largely thanks to Professor Pereira Miguel and the Portuguese presidency to the Council. The Council conclusions called on ECDC to initiate work on migrant health and infectious diseases in the EU. Since then, we have published a number of reports related to migrant health and mainly to HIV, but also to other diseases such as TB and measles. This year, ECDC made health inequalities and migrant health one of our key priorities in the work programme. With respect to migrant health, our aim is to gain a better understanding of the burden of infectious disease in migrant populations in EU. But as you all know, we are living in challenging times for public health, with much of the focus on financial crisis rather than on health and health protection. This is especially true when it comes to the emergence of infectious diseases linked to migration. Migration not only has political implications, but also implications on public health. The poor conditions in which some vulnerable groups of migrants live and work increases the risk of infectious diseases. In addition, many migrants have limited access to healthcare services, in particular undocumented migrants. So we need to convince policymakers, both at the national and European level, of the long-term benefits of addressing the health issues related to migration, and to explain the benefits of action rather than of closing countries' borders. It's every person's right to receive the appropriate treatment and care. And I would like to wish you all 2 fruitful days in Lisbon and hope you will have good discussions and will share good practices with one another. And I'm looking forward to learn about the outcomes of this meeting. ECDC is committed to work on migrant health and infectious diseases in the years to come. And I hope to be able to host you in Stockholm next year for continued discussions on any future projects resulting from your workshop today. Thank you so much for your attention.